Hello, so today we are going to be doing the elbow evaluation, and I'm Ashlyn.
I'm Nancy.
For the purposes of this video, we've both given consent to be touched for this evaluation, and this evaluation would be done bilaterally, but for the sake of time, we're only going to do it on one side, and it will stay consistent through the entire video. Our pathology that we're going to explore throughout the video is pronator teres syndrome, and we're going to get started.
I'm now going to be taking the medical history. What happened?
I was at softball practice and we did a lot of overhand throwing, working on changing the way that we released the ball.
Okay. Did you hear any noises?
No noises.
Okay. Any past medical problems?
No other previous medical problems, but my elbow hurt the day after practice and I kind of had some numbness and tingling in my thumb and my first two fingers.
Okay.
The next part of the evaluation will be the bony palpations. And so we're going to start with palpating the humerus. And for this, I'll do both the lateral and the medial sides down to the epicondyles. Okay, and then I just need you to rotate just a tiny bit. The next bone that bony landmark we're going to palpate is the lateral epicondyle. So I just need you to bend your elbow and kind of relax your hand for me, okay? And the lateral epicondyle is, as mentioned, on the lateral side. And then from this point, we're going to go into the next landmark, which is the capitulum, which is just below the lateral epicondyle, but proximal to the radial head.
Okay, we're going to continue with the bony palpation, and this is the lateral supracondylar line. So I'm going to find the lateral condyle, which is right there, and I'm going to go up. So it's right there. And then the radius is the next one, and the proximal half of the radius is covered by muscle, so you can't feel that, but you can feel the distal part. So that part you can feel. And then the lecrodon process, just my elbow, and it's that.
The next part of the evaluation is going to be fracture testing. So the first method that we'll do for fracture testing is percussion. And I'm going to percuss the humerus, the radius, the ulna, and both of the condyles. You would make sure, obviously, not to palpate on the site if you see any ecchymosis or massive swelling, because that would cause excessive pain. So I'm going to do the radius. And then if you just want to like this, and the ulna. Good, you can relax. And then I'm going to do the condyles here as well. That's kind of hard if it was pain right on the epicondyle because you wouldn't want to percuss right on them. And then the next thing that we will do is radial and ulnar distraction. So I'm actually going to have you rest your elbow on the table. So here's a stool for you. And then I'm going to be positioned behind, but if I was doing this in a clinic, I would be in front to get a better grip. We're basically just going to go like in a shearing motion. Good, and then if you can flip around. Actually, you can bring it up to that, yeah. Do the same thing with the ulna here. And there was no pain, so there's no fracture.
Okay, we're now going to be doing the range of motion test, and we're going to start with flexion. So the axis is going to be on the lateral epicondyle, just right there, in line with the humerus. Okay. Can you bring your arm into flexion? Okay, and then I'm going to passively move it as much as I can. And she got 140, which is almost within the range, the normal range. And now we're gonna do supination. So the axis is gonna be on the third finger. Start at 90, and then can you go into supination? Okay, and then I'm gonna passively move it. And she's at 95, which is within the normal range.
The next part of the evaluation is soft tissue evaluation, and for the first part of soft tissue, we're going to look at the ligaments. And the first thing that we are going to look for or attempt to palpate is the MCL complex. However, the MCL complex is deep to the musculature above it, and so I will show you and palpate on Nancy where it would be, but we can't truly palpate this because of where it is located. So if you can just bend your elbow and kind of rotate a little bit. So this is the posterior portion. The anterior portion comes out here, and then the transverse portion connects into a triangle.
Okay, I'm going to be palpating the annular ligament, which is right over the radial head. So it's going to be right there.
The next part of soft tissue palpation will be the muscles, and we're going to start with the triceps. And the triceps have 3 heads. The long head, which originates at the infraglenoid tuberosity of the scapula. The lateral head, which originates at the posterior lateral surface of the proximal half of the humerus. And then the medial head, which is the posterior medial surface of the humerus. And then all 3 insert on the olecranon process, and they are important in elbow and shoulder extension. And they're innervated by the radial nerve, which is at roots C7 and C8. So this is the long head down to here, and then the lateral head comes out here, and then the medial head is through here.
I'm going to be palpating the mobile wad of 3, and the first one is the brachioradialis. The origin is the lateral supracondylar ridge of the humerus, and the insertion is the lateral aspect of the distal radius. There. And then action is flexion of the forearm with pronation and supination, and the innervation is the radial nerve. Next is the extensor carpi radialis longus, and it originates at the distal part of the lateral supracondylar ridge, and the insertion is the distal base of the second metacarpal. Right to there. And then action is extension and abduction of the wrist joint, and the innervation is the radial nerve. The last one is extensor carpi radialis brevis, and the origin is the lateral epicondyle, and the insertion is the dorsal base of the third metacarpal. Okay. And the action is extension and abduction of the wrist, and the innervation is the deep branch of the radial nerve.
All right, the last group of muscles that we'll be palpating is the muscles in the flexor mechanism. So the first one is the pronator teres, and this originates on the ulnar head and proximal to the medial epicondyle, and it inserts on the middle 1/3 of the radius. Its action is forearm pronation and elbow flexion, and it's innervated by the median nerve, which is C6 and C7. So, proximal to the medial epicondyle on the ulnar head. To right here. And then the next muscle is flexor carpi radialis, and this originates on the medial epicondyle. It inserts on the palmar aspect of bases of the second and third metacarpals. Its actions are forearm pronation, wrist flexion, radial deviation, and elbow flexion, and its nerve innervation is the median nerve, again, C6 and C7. So if you can just turn your hand out a little bit for me. So medial epicondyle here. To the palmar base of second and third metacarpal. The third muscle is the palmaris longus muscle. This also originates on the medial epicondyle. It inserts into the flexor retinaculum, or that palmar aponeurosis. Its action is wrist flexion. It's also innervated by the median nerve, so C6 and C7. Go ahead, bring your hand up just a little bit for me. Thank you. Right to here. And then the last one in the flexor mechanism is the flexor carpi ulnaris. And this one originates at the ulnar head and the medial epicondyle again. And it inserts into the pisiform, the hamate, and the palmar aspect of the base of the fifth metacarpal. Its actions are wrist flexion, ulnar deviation, and elbow flexion. And this one is innervated by the ulnar nerve, which is C8 and T1. So again, just kind of bring it out for me. Medial epicondyle here and the ulnar head. And it's going to follow down right here to the hamate, the pisiform, and then this fifth metacarpal base.
Okay, the next part of soft tissue palpation is the cubital fossa. And first I'm going to find the brachial artery, which is median. So that's right about there. And then the median nerve, which is medial to the brachial artery. So it's going to be right next to it.
The next part of soft tissue palpation would be the bursa, and we have the olecranon bursa in the elbow. So if you can bring your arm up like this, yep. And it's going to be right here. And then the last part of soft tissue palpation is the nerve, and we have the ulnar nerve, which sits in the trochlear groove. So if you can like just medially, and it's going to sit right in here. Okay. The next part of the evaluation is going to be ligamentous testing, and we're going to be testing the MCL. This would most likely be positive for somebody that does have symptoms of pronator teres syndrome, because we're putting stress on that medial epicondyle. I'm going to do this from behind you, I think. You just want to bring this. I'm going to stabilize above the joint, and I'm going to bring the medial epicondyle forward.
Okay, now we're going to be doing muscle testing, and we're going to start with wrist extensors. So elbow straight, and first she's going to do active, so bring it up, and then now we're going to do active resistance. Make sure that you're in the right there, leg extension relationship, and then try to go up. There you go. And now we're going to do break right there. 1, 2, 3, 4, 5. Great. And now we're going to do the triceps. Okay. So first you're going to do active by yourself. Oh. And then active resistance. Try to go up. Great. And then break. 1, 2, 3, 4, 5. Perfect.
The next group of muscles that we'll be testing are the supinators. So I just want you to have your elbow bent at 90 for me, and bring your hand, palm of your hand up to the sky. Good. Go ahead, bring it back down. I'm gonna just put some resistance here. I want you to do the same thing. I'm just gonna push against you, okay?
Okay.
I'm gonna stabilize. Good. And then we'll be in the break. I'm gonna hold it for 5 seconds, okay? I want you to try not to let my hand move you, okay? 1, 2, 3, 4, 5. Good. All right, go ahead and move down on the stool for me. The next muscles that we're going to be testing are our radial deviators. So that is our extensor pollicis, our adductor pollicis, flexor carpi radialis, and extensor carpi radialis. So I just want you to bring your hand up to the sky. Good. We're gonna do the same thing. Go ahead. Good. And now we're gonna go in the middle point here. Same thing. Don't let me move your hand out of this position. Okay. 1, 2, 3, 4, 5. Good. The next part of the evaluation will be special testing. So the first special test that we're going to do is the Tinel sign. And with the Tinel sign test, we're looking for trauma to the ulnar nerve. It also could indicate cubital tunnel syndrome. And a positive test for this would be pain or numbness and tingling in the 4th and 5th fingers. So you want to bend your elbow for me real quick. You just find the ulnar nerve and percuss, basically. Any pain?
No.
Okay. And then the next special test that we'll be doing, we're going to measure the carrying angle. And real quick, little segue. So the gun stock deformity is if there's a lack of the appropriate carrying angle, which for males is 5 degrees and for females is anywhere from 10 to 15 degrees. Usually if there's a gun stock deformity, this is because of a fracture to the distal end of the humerus along the lateral supracondylar ridge. So I'm going to test Nancy for her carrying angle. Yeah, that's perfect. Out of the way. So Nancy's carrying angle is about 19, which is outside of our normal range that we're looking for. And if we have a value that is greater than the range, there is a potential that the ulnar nerve could be compromised or damaged. And then the last thing we're going to test for is cubital recurvatum. So if you just put your arm straight out for me. I'll put the goniometer up to it, but just as a visual, you don't see any hyperextension. She doesn't even get to 0 on this arm, so there's no risk of cubital recurvatum.
Okay, the next special test is lateral epicondylitis, and I'm going to put my finger on the lateral epicondyle, and you're going to resist. Try to go up. There you go. And a positive sign would be pain in the lateral epicondyle, and this would be for lateral epicondylitis, which is tennis elbow, or the inflamed lateral epicondyle or tendonitis. And now we're going to do the medial epicondyle test. Okay. Fingers on the medial epicondyle. Go. And then a positive test would be pain on the medial epicondyle, and this would be for medial epicondylitis or pronator teres syndrome. And the third test is pronator teres syndrome. Okay. And resist. And positive test would be pain on the medial side with paresthesia and pain in the first 3 fingers, and this would indicate pronator teres syndrome.
So the next part of the elbow evaluation is just functional assessment and then testing. So we would know if you have pronator teres syndrome that the medial epicondylitis test and the pronator teres syndrome test would be positive. The patient with pronator teres, we would want to see them rest. We would want to see their pronator teres strengthened eccentrically, and we would need to adjust the release point of the overhand throwing motion so it's not putting undue stress on the muscle. A functional test that we would do for this would be having the patient complete a throwing motion and throw a ball without pain in the medial elbow or pain at all to return to their sport.
But this concludes our elbow evaluation video.